Dear investors and supporters of FHL Healthcare Fund, as you know, I normally provide only quarterly updates on the fund, but we're not in a normal time. Today, I'd like to give you an update on the fund for the month of April and share with you my view on the COVID situation in the US. This slide recaptures the fund performance in the month of April. At the end of Q1, the fund had a big loss, just as the rest of the stock market. What a difference a month can make. The market roared back, defying the common wisdom and the expectation. Our fund performance was in line with the market, up 12.3%, compared with 12.9% for the benchmark Russell 3000 Healthcare. The 0.6% underperformance of the fund was all due to the drag of a high cash position. Roughly 10% of the fund is still in cash, and I intend to maintain that until I see better opportunities in the market. April performance erased Q1 loss, resulting in a year-to-date gain of 1.5%. Ahead of the benchmark by 2.87%. I'm really pleased to see the fund performing well in both good and bad market conditions. How did the COVID situation affect healthcare sector so far? COVID impact on the healthcare sector is relatively muted compared with its impact on other industry sectors. However, elective medical care services are being put off due to COVID. This has negatively impacted hospital service revenue and medical technology companies. High COVID spending was not enough to offset the low spending in other areas. This actually benefited the health insurers in the short term. Contrary to what many investors may have expected, no widespread supply chain disruption has been reported by biopharmaceutical companies or medical technology companies. Drug companies actually have less revenue impact from COVID than the medical device companies. The area that did experience a lot of disruption from COVID is clinical trials and the contract research organizations, CROs. Although ongoing clinical trials are less affected, initiation of new clinical trials or accrual of patients into existing clinical trials have all but stopped in the places where lockdown measures have been implemented. This has negatively impacted the business of CROs. However, delay in clinical trials may have helped incumbent drug companies because their generic or biosimilar competition is now being delayed. Now let's move on to the topic of COVID. I think the most pressing question we all have is how soon we can reopen the economy. Please allow me to share my perspectives on this with you. This is a chart that pretty much captures the current situation in the US. After 1.5 months of lockdown, we are seeing the infection curve flattening. The chart shows the 7-day average number of cases, which is the blue line, and the 7-day average number of deaths, which is the orange line. Both lines are flattening. Average new cases are now hovering around 27,000 per day, and average new deaths are around 1,700 per day. Before we self-congratulate, I want to show you similar chart for South Korea. Compared with South Korea, our mitigation efforts have not been very effective. South Korea has been able to totally bend the infection curve in a matter of a month from February 19th, as you can see, to March 18th. As of now, the country only reports a handful of cases per day, mostly international travel-related cases. So the natural question is, how did South Korea do it? The most amazing thing is that they did it without banning international travel or locking down the country and shutting down the economy. They applied old-fashioned, tried and true public health strategy. First, they tested extensively. Anyone who wanted to be tested could get a test. Through extensive testing, they were able to uncover most, if not all, infected cases early on, before the virus spread like wildfire in the community. For each test confirmed cases, no matter it's mild or severe symptoms, the patients were isolated or quarantined to prevent them from further spreading the virus. They also traced and monitored anyone who came into close contact with confirmed COVID patients. If any of the close contacts was tested positive, that patient would be isolated immediately to prevent further transmission. This is how they did it, a science-guided, rigorous public health approach. No political squabbling or finger pointing. Now let's look at we didn't do right. First, for some reason, our CDC was sleeping on the wheel. The US is supposed to have the best community surveillance system for infectious diseases in the world. But this time, for the reasons that I still don't understand, the system failed. CDC did not do enough testing early on. That's how the early community outbreaks were missed and allowed to spread silently in the community. Even after we did uncover community outbreaks, first of which was reported on February 19th in California, the federal government response was indecisive and incoherent. I have to give credit to the states of California and Washington for their decisive action immediately after the community outbreaks were discovered in their states. But other states and the federal government did not act quickly, especially the state of New York. There was also a lack of coordination and cooperation between the federal government and the states. It seems to me that the government officials did not appreciate the nature of exponential growth in infectious disease and how important early intervention is. The inaction and indecision cost the country dearly. Based on epidemiological modeling, a mere 15-day delay could cause 10-fold increase in the number of infections. And the month delay would not be 20-fold increase. It would be more like 100-fold increase. That is what exponential growth curve means. We wasted the window of opportunity to act early, and the result is a devastating and humiliating disaster. I think the gravest mistake is that we do not have an effective quarantine policy in place. This is the main reason, I believe, why after more than a month and a half lockdown, we are only seeing flattening of the curve, not bending of the curve, like South Korea did only in a month without lockdown. So lockdown without effective quarantine produces the same economic loss, but bring little public health benefits in terms of significantly reducing ongoing infection. Right now, only the hospitalized patients are in effective quarantine, but vast majority of the mild to moderate COVID patients who don't meet hospitalization criteria are left at home. COVID patients actually are more infectious in the early stage of the disease than in the late stage. These mild to moderate COVID patients are out in the community, first spreading the virus to their family members who then in turn spread the virus in the community when they go out to do grocery shopping or run errands. Even with social distancing is not uniformly or strictly practiced by all people at all time. On top of that, very few people wear masks, which has been proven to be effective means to reduce transmission through respiratory droplets. It's easy to criticize the mistakes, but the past is past. What should we do now? I think first and foremost, we need to isolate or quarantine every confirmed COVID patient, particularly those who with only mild symptoms. These people think they were fine, but they are actually more infectious than the hospitalized patients. Research has shown that patients' viral load actually is higher in the early stage than in the late stage of the disease. Quarantine is more important than testing. The purpose of testing is to identify the patients early on and then isolate them quickly. Without effective isolation and quarantine, why do we even bother testing? What good does testing do if we can't isolate patients? Quarantine is even more important than lockdown. If we have effective quarantine and new cases are brought down significantly, then we won't need lockdown. South Korea has proven that. So we have to implement more effective quarantine. But how? We can't just force people to quarantine. It's against our values. But we can incentivize people to do so voluntarily. Right now, hotels are vacant, restaurants are shut. It would be a better use of the economic stimulus fund if we contract with hotels and local restaurants to provide free rooms and meals for COVID patients who are willing to quarantine voluntarily in order to protect their loved ones and their community. Right now, many of them don't have the luxury of self-isolation. They may be living in a crowded apartment with family members. They have to go out to work in order to support the family. If we can support these people both medically and financially, they will be willing to quarantine. The stimulus money will be better spent this way because it supports local economy while protecting public health. This is the opposite of lockdown without quarantine, which does not have any public health benefit and still have the bad effect on the economy. We also need to protect the vulnerable population, namely the elderly and sick people. The government should hire people to take care of them for their daily needs so that they don't have to go out and about in the community, exposing themselves to potential risk of infection. In China, the government dispatched a team of people to buy and deliver daily necessities for elderly people who were asked to stay in their homes to prevent infection. The next important thing we need to do is to eventually ramp up testing. It would be ideal if we have enough tests for everyone so all of us can be tested. Whoever tested positive should be isolated, but whoever tested negative can go back to work. But that's not possible. That's why we need to prioritize testing, first for essential workers. Then we should make the test widely available for whoever showing COVID symptoms. We should also hire more medical professionals to do contact tracing work so we can prevent secondary transmission. If we can do the above, then we should be able to have phased reopening. Even with reopening, we should still mandate mask wearing in crowded indoor environment to reduce further the risk of viral transmission. In summary, I think the old-fashioned public health measures are the only effective solution to the problems we have. We cannot rely on any drugs out there to rescue us. These drugs may help speed up patient recovery and reduce fatality, but they cannot control the spread of the virus. We need to test more so we can find the infected cases early on and isolate them promptly to prevent further spread. We need to monitor the close contacts to stop secondary transmission. We need to treat patients early. Early treatment can stop disease progression and reduce fatality. Oxygen therapy and some of the drugs do help in this regard. We need to protect and support the vulnerable people among us. If we do all of these, test, isolate, trace, treat, and protect, we can defeat this virus even without a vaccine, which is years away. Thank you for listening. I would love to hear what you think. Please feel free to contact me with any question you may have. Stay healthy, stay hopeful. We will win this battle.